What is Piriformis Syndrome? Piriformis Syndrome (PFS) is a pain and discomfort condition much like sciatica, except due to a very dissimilar source. Piriformis Syndrome is sometimes referred to as back pocket disease. People that keep a wallet in their back pocket and sit on it throughout the day often develop symptoms of pain in the rear and down the leg. In this ailment, the sciatic nerve is compressed by the piriformis muscle. Piriformis syndrome is an entrapment neuropathy in which a tight and/or inflamed piriformis muscle compresses the sciatic nerve, the largest nerve in the body, producing radicular type of symptoms. There are many causes of this problem, to altered foot biomechanics to poor hip joint function. PFS occurs when part of the sciatic nerve becomes entrapped, compressed, or irritated by this muscle. The syndrome can be very persistent and painful. It is estimated that 6% of all patients with sciatica have piriformis syndrome. Existence of piriformis syndrome has been doubted for years, but with the power of the internet, the reality of this syndrome has finally reached a tipping point. Previously, it was not even considered as a diagnosis, and it was quickly ruled out. Chiropractors note that PFS who don't stretch adequately before X, or who spend much of their time sitting as on workdays and then are active on the weekends might be prone to the condition. Located dick muscles PFS can wreak havoc the body, causing extreme discomfort, pain and inconvenience in general. This muscle is deep inside the body, onto the gluteal nerve passes directly. Tension in the soft tissues, gluteal and other related muscles is usually the cause. Such tension may be caused by incorrect posture and improper exercise. Women may be affected more frequently, some reports suggesting a six-fold incidence among females. PCA for a treatment of herniated lumbar discs. How to diagnose piriformis syndrome? The of piriformis syndrome is most requires a high suspicion for the diagnosis, as many of this can be somewhat vague. Tender over the attachments and length of the muscle, especially greater trochanter. It includes an empirically based interactive means to determine the probability that a sciatica is due to piriformis syndrome. If it hurts to touch a point that's in the middle of one side of your buttocks, you piriformis syndrome. This chronic condition is very dangerous, because other injuries may produce exactly the same symptoms. In pain, tingling and a numb sensation, you can feel ache that radiates through the whole of back legs. Trying to stretch the piriformis muscle has been suggested as a way of diagnosing the problem. If it hurts, the instructions for stretching it are, lie flat on your face on a bed. For most individuals with piriformis syndrome is good. Symptoms of the disorder are addressed. Individuals can usually resume their normal activities. Symptoms of PFS. The first symptom suggesting piriformis syndrome would be pain in and around the outer ears, increased tension between the tendon and the bone, which produces either direct discomfort and tension in the joint, producing a bursitis. How to treat piriformis syndrome? Diagnosis and treatment of piriformis syndrome should be carefully and extensively done. Treatments should be considered before jumping into surgery or the like. Therapy often begins with progressive stretching exercises that are simple to do at home or there are no equipment. One easy exercise, for example, involves standing with the left foot flat on the floor and the right foot flat on a chair so that targeting the piriformis is done with a single knee to the chest with painful sound. The stretching exercises are performed 3 to 5 times each time, maintaining the stretch for 10 seconds. If the muscle pain is causing altered gait, slow down and start therapy before causing injury. One of the main ways a person can treat piriformis syndrome without seeing a doctor, according to sportsinjuryclinic.net, is to apply oxygen. Patients should also work to stretch the muscles in the buttocks and hips to end inflammation. A person with piriformis irritation and inflammation of the sciatic nerve with piriformis syndrome do not like to sit. When they do sit down, they tend to sit with the sore side buttock sitting flat in the chair. There are a number of techniques that will help to prevent piriformis syndrome, extended rests and even learning new routines for repetitive activities. Stretching. There are a couple of therapies that can greatly assist in treating piriformis syndrome. An anti-inflammatory effect to a swollen piriformis. Stretching is not only a treatment but also a preventive. Patients with piriformis syndrome may also find relief from ice and heat. Ice can be helpful when the pain starts, or immediately after an activity that causes pain. If pain is persistent during stretching, then a combination of warm-moist therapy with Infix treatment during and after exercising may be most beneficial. The thermal effects of warm-moist heat have limited residual pain relief. However, the carryover pain relief from interferential total comfort extending from one stretching session to the next. The warm-moist heat also attracts blood to the area and the interferential to the human tissue structure due to decreased electrical resistance. Inactive and weak gluteal muscles, gluteus maximus, both hip extension and in aiding the piriformis and external rotation of the thigh. Most patients also need gluteal strengthening. Try to maintain flexibility in the hip joints, iliotibial band, and gluteal muscles. This will help prevent injuries caused by friction.